Welcome to another edition of the Fire Brigade Union podcast. Today we're going to focus on the Fire Brigade Union's fight on cancer. I'm standing in as a guest host of today's podcast. I'm Adam Taylor. I'm a National Officer at the Fire Brigade Union head office. Today I'm joined by Wes Streeting, the former Health Secretary. Hi Wes, how you doing?
Yeah, very good. Thanks for having me.
Yeah, good. You surviving the heat? It's very hot outside.
Yeah, one of the advantages of not being in government anymore is every day is dress down Friday. So I'm definitely not dressed for the office and putting on a suit and tie in this weather.
Yeah, don't blame you at all. Look, before we get going with Wes, just a bit of background to why we're here. So the FBU's fight on cancer, the campaign has fundamentally changed the conversation around firefighter health. Through the Decon campaign, which all of our members are familiar with, the union has demonstrated that occupational cancer is one of the greatest long-term risks, facing firefighters, and we have successfully pushed firefighter health onto the national political agenda. At the FBU Health and Safety Summit in April 2026, the then Wes Streeting Health Secretary announced a series of significant commitments, acknowledging that firefighters had been ignored for too long, and launching the Firefighters Concordat on health and well-being. For the first time, a UK government committed to a national health surveillance, firefighter-specific research and improved NHS data collection for firefighters. That was a huge milestone in our fight on cancer. So I'm really pleased to have you join us, Wes. Just in your own words, what's your take on what you delivered in April?
Well, in some ways it was a no-brainer, and I was surprised that when you and Steve came to see me, we didn't have in place the things that the government has now committed to, because it's obvious to me, just as a citizen, that fire brigades enter all sorts of dangerous environments, expose themselves to all sorts of risks, and that we have a responsibility as a society to care for the people who care for us and put themselves in harm's way in order to protect us. What I didn't know is that the risks that firefighters face often don't materialise until much later. And in some ways it should be an obvious point, but it's the scale of it that really shocked me. For example, more firefighters have died from illnesses related to their response to 9/11 than died on 9/11 itself in the New York Fire Department. And of course, when you think about it, it's obvious, there are all sorts of risks of exposures, smoke inhalation, the sorts of chemicals and materials that people might be exposed to, in the worst fires. And then as I thought about it more broadly, I was thinking about some of the other challenges that the fire brigade will experience, that actually lots of the staff that I was responsible as the Health and Social Care Secretary would experience, in terms of the stress and strains of a challenging working environment, some of the mental health pressures that people face, and that's not just the people who are on call-outs and putting their blue lights on, it's also dispatchers and handlers who will be dealing with very distressed people at the end of a phone, and we'll be thinking about the consequences of what happens if a fire engine doesn't get there in time. So it got me thinking more generally about the health and well-being of firefighters and actually staff right throughout the fire brigades across the country. And then what really shocked me as well is when we met, I did what a lot of ministers do in that situation. You then take official advice and you go away and look at things in more detail. And I was getting advice that was saying, well, look, in terms of what you want to commit to, there isn't really evidence in this area to sort of support this sort of action. And I was saying, well, hang on a minute. There's no evidence. That in itself is a call for action. Why do we know so little about the health and well-being of people who are exposed to serious risks? And so, I'm really proud of where we got to. I think there's obviously a lot to do now, because we've got to translate words into action. But I also hope that is in itself a healthy process, because there's one thing that's really in short supply in this country, even more than money at the moment. It's trust in politics and politicians and the ability of government to deliver. And I hope that FBU members will see through the process that we'll now go through together the difference that having a Labour government makes, the difference that the FBU can make influencing government and having a seat at the table and speaking up for and fighting for the interests of firefighters. Absolutely.
Just going kind of back to the beginning of when we met, you mentioned that Steve and I met with yourself back in March this year. It's certainly a drive of the General Secretary to make sure that we're sitting down with the politicians that can make changes for the better for our members on whatever that may be. And on this occasion, it's about health and about the future health of firefighters. And then following on from that, myself and colleagues at our head office, we met with numerous individuals. I think somewhere in the region of 20 to 25, whether it's specialist advisors to yourself, political advisors. I think in one meeting we met with the deputy medical officer to the UK government. Clearly, you placed a lot of importance on this. You put a lot of people into this. Yourself was across the detail of it. Just again, why so important?
Well, that is the great thing about being a Secretary of State, is that if you show an interest in something, the department responds. And so, thinking back to that initial conversation, one of the things that was most powerful about it was Steve, actually, and talking about the challenge, not just in terms of numbers and statistics and advocating for FBU members in the way that you guys do day in, day out. But, he's from a family of firefighters. His dad was a firefighter, his son's a firefighter, he's a firefighter himself. And when Steve was talking about losing his dad to lung cancer, that really struck with me, because these aren't just statistics. These are people's lives. And too many lives are cut short. And one of the great things about being the health secretary is that when you're making positive change, you are changing lives and saving lives. And what I was trying to do as the health secretary was kind of three things fundamentally. One is to sort of modernise the health service, make sure we've got all the latest cutting edge medical science and technology to make the service as effective as it could be. Making sure that we diagnose and treat people a lot faster, but also make sure we prevent illness in the first place. And if you get to someone at stage 1 with lung cancer, their chances of survival are so much better than if you get them at stage 4. So making sure that we are screening effectively, looking out for symptoms, making sure that when people do come forward, that they can get access to those tests and scans more quickly, that their risk profile is understood. So if you're going along and you've got some of the telltale signs of lung cancer and you're telling your GP you're a firefighter, they think, maybe you have been a firefighter in your career if you've retired, and picking that up and thinking, okay, that doesn't just tell me it might be a chesty cough. I've got something here that makes me more curious. Well, that can be life-saving and life-changing. And then similarly, on the prevention side, one of the things I'm looking forward to is building the research around the experience of and the risks associated with being a firefighter, so that we can try and protect our people much more effectively.
You announced a concordat.
Yep.
Just explain. I had to Google what a concordat was.
Yeah, so did I.
Yeah. What is a concordat? And then we'll talk about what it means specifically.
I suppose it's a posh word for a charter or agreement, isn't it? It sounds very grand, firefighters concordat. And in a way, I'm glad, because having been overlooked for so long, I think it is important we make a song and dance about this and make sure that it is high profile, so that in the future people don't come in and try and unscramble it and unravel it. Because that's the thing, when in politics, you constantly have to drive things forward. So I came out of the meeting with you guys and I was like, right, we're going to act on this and we're going to do it quickly. This is a no-brainer. And then the system starts to kick into gear and you get this advice up saying, well, what if we sort of commit to a review about whether we should do something about this? And what if we can maybe consider options about whether we might eventually do something? And I was like, I'm not having any of that. We need to act. We need to act more quickly. We've got to build the evidence base. We're going to do it with the FBU, not to the FBU. We've got a great partner and Fire Minister in Samantha Dixon over at Ministry for Housing, Communities and Local Government. She was really excited when we were talking to her about this. Sometimes in government there can be a bit of cross-departmental rivalry, and you sometimes get people who a bit like, oh no, hang on, what you're doing on our turf, that's our job. But she was so enthusiastic, was like, great, I'm really pleased to see the Department of Health taking the health of firefighters seriously. So she was with us, and that helped to drive progress more quickly. But you, in government, as a politician, you do have to drive things and you have to push things. And if you want to see something done, you have to keep a sharp eye on it. You have to keep pushing forward on it. Otherwise, sometimes the system finds excuses and reasons why things shouldn't happen. In fact, even when I was coming up to your Health and Safety Summit, right up to the 11th hour, there was a debate in the department about whether I could visit in an official capacity as the Secretary of State on behalf of the government, or whether this was a political visit, as if I was like out going campaigning for some Labour Party members or something like that. And I said, look, hang on a minute. The FBU might be affiliated to the Labour Party, but I'm making these commitments as a government minister because we have an obligation to our people. So there were plenty of pure bureaucratic hurdles that nearly got in the way. But in government, as you know, if you're an effective politician, you've just got to bulldoze through those things, and that's what we did. And I found that event quite moving, actually. Obviously, there were a lot of people in the room who've been affected by it, directly or indirectly. A lot of people who are worried about their own health and well-being. And I also could tell when I walked into the room, like, frankly, there are a lot of people in this country, including FBU members, who do not have a lot of time for politicians at the moment. I think we're, less popular than traffic wardens and estate agents. And let's be honest, this Labour government has made some mistakes, and the current Prime Minister hasn't been particularly popular. So I could tell I was walking into a room with people who were, from the moment I walked in, very respectful, keen to hear what I had to say, but were probably, I think a lot of people would have just been sat there thinking, right, what's this politician going to say? Is he just going to spout off a load of platitudes and then walk away? And I think, what I got from the room, I think people could see the genuine commitment, the work we had done together, and the commitment to work in partnership to make the words and the commitments a reality. And that's really what the concordat is about saying, these are the things we're committed to doing, but we're going to do it together. And the FBU is going to be around the table, making sure that we get the policy right in the first place, and then secondly, to make sure we actually stick to it and it makes real change for firefighters.
Yeah, I think, obviously we had 100 health and safety reps from right across the UK. We had, as you say, some emotional sessions, actually. We had Ann Davis,
that's right.
the widow of Jeff Simpson, a firefighter that lost his life to cancer. Yeah. And the coroner attributed that cancer to the job of the firefighter. And we think it's the first time that's happened, certainly in England, if not the UK. So yeah, a huge event. And I think actually our members in that room, they see that operationally on the things that you say you're going to commit to, you tend to deliver. Yeah. So I think actually that's why it was taken away as such a positive announcement. Yeah. And you announced a number of different, I suppose, proposals. You announced that the concordat more broadly, health monitoring and a health provision package, data collection by the NHS. So where do you see this kind of ending up? What do you see sort of being in place? Because you also spoke about a particular time frame of next year having some of this. Yeah, well,
that for me was really important. I really feel strongly that if you want to deliver change, you have to show people as quickly as possible that things are moving, that things are happening, because otherwise people lose faith and lose heart. And also you lose progress. So you always, and to be fair to different governments, to be fair to the civil service, there are loads and loads of things going on every day and loads of competing demands. So you have to build in, milestones so people can be held to account, and you can check your progress and think, oh, actually, the good thing about that, the timing of your summit, I was saying inside the department, I'm going to that summit. I'm going to announce the concordat. So it's got to be ready in time for that. Because I thought if I set that as the deadline, they'll all move faster. Yeah. Whereas if I said it would be nice to do it, but no worries if not, we'd probably still be talking about it in February next year. So, so that was good. But yeah, it's about holding to it. And the National Institute for Health Research, as well as helping with the data collection and the evidence base, is also going to measure progress against the concordat, which is good. Where I'd like to see us get to, and where, in some ways, where I'd be surprised if the evidence doesn't lead us there, is more effective screening and more effective medical pathways for firefighters, past and present, because I'm pretty sure there'll be lots of people listening who may be retired from the fire brigade, and just because you've left the fire brigade doesn't mean that the risks you were exposed to as a firefighter have been left at the door the last time you walk out of the station. So, I want to make sure we get to a point where we understand the risks, we understand people's experiences and health needs while they're serving, after they've left the fire brigade or they're retired, and then make sure we build the health service around people. Because the other thing I was trying to achieve as health secretary is to make sure we've got an NHS that is designed around patients and recognises that we've all got our own individual health needs. We're all different. We've all got different risk factors. So having as personal a service as possible that understands the patient in front of them, understands their genetics, understands their occupational risks, understands their lived environment, and and then can design testing and treatment around those risks. That's where we want to get to.
I want to pick up on that explicit point, actually. We talk about retirement. I think a phrase that was used in your announcement, and a phrase that's been used certainly since in the conversations around what the concordat is responsible for, and some of the kind of offshoot aspects of that is beyond service. Will this announcement, will this have a direct impact on firefighters that have already retired? Will there be any benefits to firefighters that have retired already and obviously going into the future?
Well, that's what I want to see. I think the research should certainly cover those people, but I'd be very surprised if it doesn't lead us to also thinking about those risks that people carry with them after they've left the fire brigade. And there are all sorts of other debates to be had about the nature of being a firefighter, the demands, the physical as well as mental demands of the job, things like the retirement age and all those sorts of things. Like we're all living longer. We all want to live well for longer. Big part of the public health agenda is about helping people stay fit and active and strong, building their muscle mass, their bone strength. But even with all of that progress, and even if, I hope to live and work to a ripe old age, but there's a big difference between working in an office and working in a very physically demanding and dangerous environment like being a firefighter. So I think those are the sorts of debates we need to be having as well.
Staying with cancer, recently I spoke actually at a European Firefighters Network, and so hearing from places like Greece, Germany and other parts of Europe about the progress they're making in their fight against cancer. And one of the things that I sort of took away from it, a few days after that, there was an announcement in Norway where they introduced legislation that we call presumptive legislation in the UK, and it's presumptive legislation in other parts of the world for different types of cancers. So, for example, if in Australia, if you've been a firefighter for so many years and you are diagnosed with a cancer, then it's automatically assumed you get it from the job of being a firefighter. I think ultimately that is our goal in the UK. That's certainly the goal of the FBU, that will better protect our members. Obviously, we need to mitigate against cancer. We need to prevent it happening. But the World Health Organization says it's going to happen. The job of being a firefighter is very much linked to getting cancer. Do you think this should support in the future presumptive legislation? Do you think this research can lead to that going forward?
Yeah, quite possibly. And I think we should be looking at the experience of other countries and seeing how that's working in practice, what we can learn from it, how we might move forward as a country. And also, as you say, how can we protect and mitigate against the risks of cancer that come with, being in the fire brigade, and whether that's thinking about kit and equipment, as well as things like your diagnostic tests and checks and scans. I think that's exactly where we need to go. Because for me, this is a fundamental kind of moral argument, which is, we are asking people to do a tough, demanding, and sometimes dangerous job to protect the lives of others. So I just think as a society, we have an obligation to protect those who protect us. And I think it's fairly obvious to me in common sense that there are greater risks associated with being a firefighter. The more we can evidence and prove that, the better we can design the right care and support, and to make it as easy as possible for firefighters to get that support. Because too often as health secretary, I saw people, and I see it as a local MP as well, people having to fight for things that they should get by right and by fairness. So the easier we can make that for people, the better.
What's your expectation in terms of individual employers? So we negotiate with national employers on our pay terms and conditions, but the concordat's done through the Ministerial Advisory Group. It's an agreement, as you mentioned previously. Do you think employers have a responsibility to sign up to it?
Yeah.
Do you think it should be mandatory? What's your take on this?
So I expect all employers to sign up to it, and I think that there is the option available to the government to make it mandatory. That would have taken longer, because when you mandate things, you then have to have loads of consultations and you slow the whole thing down. So I think there was definitely an advantage to going sooner with something that's initially an agreement that people sign up to. But I also think that's an opportunity. I think it's a real opportunity for employers to opt in and to do that quickly, positively, enthusiastically, to show their workforce that they care. So I'll be watching really closely to make sure everyone signs up. And if they don't, they'll have to explain why. And I think, to be honest, they'll have to explain to firefighters, like, why is it that you as an employer care less than others? So let's hope we don't get to the stick. Let's hope we initially, I think it's a great opportunity for employers to actually know we really value you. We care about your health, we care about your well-being, and we're on board. So that's the opportunity they've got.
That's a really good take on it, actually. And I think, we often look at different employers and, what they bring in to support, our members. And actually it's a good measure. So I think, really good take. Your announcement, we have spoke, primarily about, kind of the impacts on our fight on cancer, but it's wider than that, isn't it? It covers firefighters' health and well-being more broadly. And we're in the middle of our mental health campaign as well.
Yeah.
We're hoping to launch best practice next year in terms of mitigating against, poor mental health in the fire and rescue service. I think a lot of our members, are dealing with mental health at the moment. None more so than our members in control rooms. The firefighters that mobilise fire appliances, deal with critical calls, giving life-saving guidance, across the phone. So how important is this work to mental health and what we're dealing with at the moment?
Yeah, firstly, I'm really glad that FBU is running this campaign, because I feel when it comes to tackling mental ill health and promoting positive well-being, the NHS can't do it on its own. We need everyone involved in this, and whether it's FBU as an employer, whether it's FBU standing up for your members and helping to change the working environment, support members, you can be a really big part of improving the mental health and well-being of the nation. And there's no doubt in my mind, especially having been responsible for the NHS and our emergency services on the health side of things, it's a really tough, demanding job working in those control centres, especially if resources are limited, especially if demand is high, because you're the person who's at the end of a phone, sometimes talking to a very distressed person who's frightened about whether you're going to get there in time, maybe in a very dangerous situation, and you're the person who is kind of metaphorically holding their hand at the other end of the phone. and they're worried about it. You're trying to be reassuring at the same time as you're looking at your screen, thinking, are the appliances going to get there in time? Are we going to, be there for them where they need it, when they need it? And feeling that stress and pressure and feeling those with pressure on your shoulders at the same time as you're trying to mobilise your own team without making them too stressed as well. These are hard, demanding jobs. So I think, it is important that we look beyond the physical health risks and also think about the well-being of our workforce as well, and keeping people well at work and helping them to deal with the stresses and strains that come from working in a very rewarding and socially, it's just such a high impact, valuable thing to do for society. But because it matters, it can be really stressful. You don't want to let people down, and sometimes people carry that weight on their shoulders and their conscience too heavily, and we've got to help them with that. Yeah.
Wes, you've come in today. You're advocating once again for improving firefighters' health and well-being. I'm assuming wherever you end up in Westminster government, you'll continue to advocate for better firefighter health and well-being. What comes next, from this? Yeah,
so the reassuring thing, I think, for people watching and listening is that I checked in with my old department before coming on today to say, how's it going? I'm, going to talk to the FBU, how's things going with the concordat? And things are moving along nicely. So I'm not the health secretary anymore. James Murray's come in. I think he's doing a great job. And things are continuing to move. It's not been dropped just because there's a different health secretary that's come in. So I hope that reassures people the progress will continue. And look, as I'm speaking to you today, the nominations have just opened for the leadership of the Labour Party. I've been in and nominated Andy Burnham this morning. In fact, I was the 81st nomination, so we know he's definitely got 81. And look, I think he's going to win by a country mile. So I think I can confidently sit here today and say Andy Burnham is nailed on, going to be the next leader of the Labour Party and Prime Minister of the country. And the good thing about that is I've no doubt about his commitment. No doubt about his commitment to the fire brigade. I know that Steve's already spoken to him, and one of the things that Steve's flagged with him is the importance of the firefighters concordat, and I think Andy will be very committed to that. So whatever I'm doing next, I will be keeping my eye out too, make sure we keep the progress going. It's something that's important to me, important to you, and important for building trust in politics and in politicians. And I think, it wasn't easy. When Steve spoke up, I think he was one of the first trade union leaders to say, look, we need a change in the leadership of the Labour Party. And the reason he did that is because he was speaking for his members. And to be honest, I think Steve spoke for a lot of people beyond the FBU memberships, for a lot of Labour Party members, but also for a lot of people across the country. We don't want to let people down. People voted for change at the last general election, and it is really important that we deliver it. And I think for people in the fire brigade, for FBU members, I think this is a real chance to show that politics can be a force for good, that voting can change things, and that the relationship that the FBU has as an affiliated union within the Labour Party delivers. And because the thing is, it's not a transactional relationship. It's not just, we affiliate, we have some votes and we come along and we put pressure on, although sometimes pressure is needed to get the right outcome. That's part of politics. But it's also values. Like, why is it that the FBU is part of the Labour Party, part of the Labour movement? Why was the Labour Party founded all those years ago? It's because we understood that for centuries, those with power have been privileged. And we needed a political force to stand up for the rights, the interests of people from ordinary working class backgrounds. And that's the origin story of the trade union movement, but it's also why trade unions came together to found a party to serve the interests of Labour, the interests of working people. And that's been a big part of what I committed to with you guys, was a values-driven case for looking after the people who look after us and making sure we're doing the right thing and not overlooking people or considering people to be expendable. or that their voices and their health and their well-being matters less. So I'm actually, for the first time in a while, feeling optimistic about the country, optimistic about our country's future, but also optimistic about what we can do together for firefighters across the country. It hasn't always been easy. I think successive governments have let firefighters down, and I think people are feeling it, and that's certainly what I think FBU members have been telling us. So this is a real chance actually to turn the page, to deliver for people, and to show what a difference we can make. And I think Steve deserves a lot of credit actually, both for the leadership he's shown, is calling out, when things are not going well and demanding a better government, but also the leadership he's shown standing up for the health and well-being of firefighters, which obviously matters a lot to him, given his dad and his family.
I think the trust point you made there is vitally important. There's a whole sort of spectrum of different reasons why politicians are voted for, but certainly for our members, what we're trying to do at the FBU is focus on our members' issues and drive forward change to better their terms and conditions and on this occasion their health and well-being. And your announcement was incredibly positive back in April. And I think you're absolutely right. We need to, focus on driving that forward and actually seeing some real results and starting in 2027, just like your announcement indicated it would. And look, there is some progress already. I know that the Concordat Task and Finish Group, which sits under the Ministerial Advisory Group, that's going to be meeting later this summer with terms of reference to kind of scope out what the Concordat is responsible for and set those standards for firefighters' health. So, we really need to make sure that we continue pushing that forward. Look, Wes, thanks for joining us at our head office today. I hope you've enjoyed your time on our podcast. I'm certain that our members listening, watching today, will certainly appreciate hearing from you directly what your announcement was about how we improve firefighters' mental health and well-being. Any final words from yourself?
I need to say thanks for having me, and I'm really proud of what we've done together so far. I know that whatever the changes that are coming in the next few weeks, the one thing that won't change is the Labour government's commitment to this concordat and commitment to firefighters across the country. So it's definitely a case of onwards and upwards, thanks to FBU and our partnership.
Brilliant. Cheers. Thanks for joining us, Wes.
Thanks for having me.
Thanks for joining us today. Thanks for listening. Thanks for watching another episode of the Fire Brigades Union, soon to be award-winning podcast. Tam will be back with us for the next episode, and I look forward to seeing you again. Cheers all.